Dr. Barnard, I welcome you to our channel, and I thank you for giving us your time. And it's a real honor to be able to talk to you.
Well, thank you very much. It's great to be with you today.
Okay. Could you talk a little bit about yourself and how you got introduced to the concept of a whole food plant-based diet?
Yes. First of all, thank you for asking about that, and thank you for including me today.
Thank you.
I have to say that a plant-based diet was not in any way related to anything I ever heard of when I was growing up. I grew up in North Dakota in the northern United States near the Canadian border. And there pretty much everybody ate meat on a daily basis, and we didn't hear much about vegetarian diets or vegan diets or anything like that. But a couple things happened. One is that the year before I went to medical school, I had a job helping out at autopsies. So when people died, I would help the pathologist to examine the body to determine the cause of death. And that is quite an education, I have to say. And one day we had a person who died of a massive heart attack. And so the pathologist removed a big section of ribs from the chest and set the ribs on the table. And that exposed the heart, which was filled with atherosclerotic plaque, and it was quite an eye-opener for me. At the end of the exam, I had to clean everything up, and so I put the ribs back in the chest and I sewed up the skin. And then when I went up to the hospital cafeteria, I discovered they were serving ribs for lunch that day. And, it looked like a dead body, and it smelled like a dead body, and I realized it is a dead body. It's just, so anyway, I didn't become vegetarian right away, but that planted a seed, and within about a year I stopped eating meat products, and then after a while of further reflection, I realized that dairy products and eggs weren't doing me any good either, and I got rid of them, and I've continued to explore other issues since that time, like should we reduce oil in our diet, and what about sugar, and how much raw and how much cooked, and those kinds of things. But that was really kind of what started it all.
Okay. Okay, now looking at things from the point of a patient, when they go for screening, what are the tests that they should be looking at, and how are they then classified as type 1, type 1.5, or type 2 diabetic?
Yeah, okay, great question. And hopefully we'll focus on the type 2, of course.
Yeah.
Type 1 is a condition where the pancreas isn't making any insulin at all anymore. And that's because the insulin-producing cells, the beta cells in the pancreas, are dead. In type 2 diabetes, that's where we have the beta cells are still making insulin, but the cells of the body are resisting its action. They're not responding to insulin in the way that they should be. And then type 1.5 is the term that sometimes people use for a type of diabetes between the two. But the thing that's really important to know is that type 2 is by far the most common. It often occurs years before it's actually diagnosed.
Yeah.
And both type 1 and type 2 are good reasons for following a plant-based diet, although our goals for them are going to be a little bit different.
True. How does the patient come to know? Most of the time you get a report and nowhere is it mentioned, they never know whether they're type 1 or type 2. So what is the criteria for classifying them? I mean, from the report, does the doctor come to know, or how is it?
Well, if the patient, the simple thing from the patient standpoint is that if they can get by without injecting insulin, it's not type 1.
Okay.
If a person has type 1, their body isn't making any insulin anymore. And so they are going to need to be taking insulin injections. And if they're getting by without any medication or with oral medication alone, if they don't need insulin, then it's not going to be type 1.
Okay. What actually causes diabetes, and what is insulin resistance?
Yeah, let me start with type 1 briefly, even though that's a small number of cases. It's an ongoing question as to what kills the beta cells in the pancreas. Why have they been killed off? And one of the theories for that is that it might have to do with cow's milk products. And that's really shocking to people. But the idea is that the baby, a human baby is, if I can use this word, the human baby is designed for mother's milk, and the mother's a human being. And so when the baby is exposed to cow's milk products, either as a baby formula, or maybe as an ingredient in some other foods, or perhaps even from the baby's mother, drinking the cow's milk and some of the cow's milk proteins going through and getting into her milk, one of these routes might cause the baby to start to react to cow's milk and might start to produce antibodies to the cow's milk. Antibodies are like torpedoes that can destroy things. And so one of the big theories is that when children are consuming milk from another animal, that they respond to it by creating antibodies that destroy their own insulin-producing cells. That's still a theory at the moment, but there's a fair amount of evidence supporting it.
Yeah.
And the take-home message here is that children should be breastfed by their mother. And even though it's many cultures, including my own culture, had milk as an integral part of it, we don't have any need for cow's milk at all, and we're better off without it. Now, type 2 is the biggie here, that 90% plus of people with diabetes have type 2. And there, it's a surprise. It's the buildup of fat inside the muscle and liver cells causes the cell to not respond to insulin anymore. So that people are used to thinking, well, I got diabetes from eating sugar or something like that. The big issue here is that the buildup of fat inside the cell means that glucose doesn't get in anymore. And when we get the fat out of the cell, the body responds to insulin again and can take the glucose into the cell.
True. Yeah. Okay. Once the reports point to a diabetic condition, what should be the first line of treatment, and what actually happens in Western medicine as opposed to a whole food plant-based diet?
Oh, great question. Well, the first thing that should happen is that the patient should sit down with a doctor and hopefully a dietitian and talk about what causes this disease. And if it's type 2 diabetes, we need to explain to the patient that the buildup of fat in the muscle and liver cells, that's the problem. That's the reason insulin doesn't work on the cell anymore. And then we also need to help the patient to understand what kind of diet will make that fat diminish.
Yeah.
And so if we avoid animal products, meat, dairy products, eggs, then there isn't any animal fat in the diet anymore at all. And if we keep vegetable oils very low, then there's not much of any kind of fat. And that means that we can expect the fat in the cells will start to diminish. And as it does, then the cells can respond better to insulin's normal signaling. So that's the idea. And when the patient understands that, suddenly the patient will be your ally, and the rest is much easier.
True. But what exactly happens in Western medicine? What is their approach?
Everything I just said is neglected. Instead, the patient takes, the doctor takes out a prescription pad and writes down a prescription for metformin, which is an oral medication, 500 milligrams once a day. And then that's not enough, so it's 500 milligrams twice a day. And that's not enough, so you go to 1,000 milligrams twice a day, and that's not enough. And so we start adding other medicines, and then sooner or later the doctor says, well, I think it's time for you to have insulin, and the patient says, I don't want to inject anything. And the doctor talks the patient into it, and that's where it goes. And the diets that are used typically are not very strong. They'll say cut calories to lose weight, but people don't do well cutting calories. They get really hungry, and they start to binge eat. Or limit carbohydrates so there's not much sugar in your blood. But that was never the problem in the first place. So I'm sorry to say, in response to your question, that the dietary causes of diabetes are neglected. Happily, that's changing. There are more and more doctors now who are promoting a dietary approach, especially a whole foods, vegan diet, plant-based diet.
True.
And that gives us optimism for the future.
True, very much true. Okay, some people's blood sugar levels are stable during the day. What happens is in the morning, their fasting blood sugars are high.
Right.
And then the doctors ask them to take high insulin dose at night, not to eat any carbs in the night. So what's going on here?
Well, what might be going on is that your liver is showing how much it cares about you. During the night, you might be asleep, but your liver is wide awake, watching your blood sugar levels rise and fall. And you haven't had any food since dinner time and you've been asleep. So your blood sugar is starting to go down and your liver notices that. And so the liver has stored sugar, stored in the liver, and it releases it into the blood. And so if you happen to get out of bed at 6 o'clock in the morning and you checked your blood sugar, and it might be in a normal range, and you went back to sleep for an hour and a half, and you checked your blood sugar again, even without eating anything, your blood sugar can be higher. And that's simply because your liver has been dumping a little extra sugar in the blood, thinking you were going to get up pretty soon, and you might need some energy to get through the day. It's referred to as the dawn phenomenon. As in other words, the day is dawning, and so your blood sugar will rise to get ready for it.
So even if you're on a plant-based diet, these symptoms can show up?
It's a perfectly normal phenomenon, and it can happen to lots of people, including people on vegan diets. It's not a bad thing.
So, okay, there's nothing to worry about when you look at a high, okay.
Well, no, I'm not saying that high blood sugar levels should not be a cause of concern. What I am saying is that it's normal for blood sugar to rise during the early morning hours.
Okay, yeah.
Now, if your blood sugar is really high at any point, or if it's extremely low at any point, those are things that should get your attention and may require action. But the dawn phenomenon is totally normal.
Yeah, okay, thank you. The conventional diabetic diets promotes a low carbohydrate. Initially, they get very good results. Their blood levels come down, they lose weight, their cholesterol levels are also good. But in the long term, they start facing problems. What are your thoughts on this?
Well, it's a great question because there are a number of people who have been interested in low-carb diets, and I don't think they're safe. I think it's a very bad way to go. But I do want to point out that I don't think it's by any means most people are interested in low-carb diets. If you look at the American Diabetes Association guidelines, that's one way that a person can go, but they also embrace vegan diets and other approaches too. So they're not really in the low-carb camp, I wouldn't say. But the approach that you described is one that you do sometimes hear about, and it's based on an understandable idea, but a wrong idea. And the understandable idea is, if I have diabetes, I have too much sugar in my blood, and carbohydrate-rich foods like potatoes or rice will release glucose, sugar, into the blood as they're digested. And so if I've got too much sugar, then I should just stop eating all those carbohydrates, and then my blood sugar will come down.
Yeah.
And that's true. If you don't eat any starch, if you don't eat any noodles or any rice or any potatoes or any fruit or any bread or any of that stuff, your blood sugar is likely to fall. But you're just treating the symptom. The cause of the type 2 diabetes is that the buildup of fat inside your cell means the cell can't take the glucose out of blood like it normally should. The human body is designed to work on carbohydrate, just like your car works on gasoline. Your body is fueled by glucose that comes from carbohydrate. And if the carbohydrate releases the sugar and the sugar can't get into the cell, stopping eating all that is one answer, but it's not a very good answer. The better answer is to eat healthy carbohydrates and clean the fat out of your cells so that you can fuel your cells in the normal way that nature had in mind for you. Because here's the danger. When you look at people who follow a low carbohydrate diet, their mortality rate is higher than other people.
True.
For some will lose weight only because carbohydrates are it's the majority of what people eat. So if you're not eating any of it, you're going to lose weight. And when people lose weight, often their cholesterol levels will fall as a result of that. But for about 1/3 of low-carb people, their cholesterol levels go up, because when you're not eating carbohydrate, what are you eating? You might be eating meat or cheese or something like that. These are really unhealthy foods that raise your cholesterol level. Many people have terrible digestive problems as a result. And so, yes, you will see fads of low-carb diets, but over the long run, it's really not a good way to go.
True, very true. A lot is talked about the glycemic index. Don't eat fruits, don't eat potatoes, don't eat white rice. You will see a spike in your blood glucose levels. How the glucose index when we are on a plant-based diet? Does a plant-based diet eventually balance out the glycemic index of individual food items you eat?
Oh, sure. The glycemic index, I think, is a fine thing. It was invented in 1981 by David Jenkins, who is a researcher in Toronto, at the University of Toronto. And he himself follows a vegan diet, and he actively promotes it. And he's right. I think he's a tremendous pioneer, and a wonderful advocate, and a very, very careful and insightful researcher. But for the people who've heard the words glycemic index, let me make it simple. All it is a measure of the effect that certain foods have on your blood sugar.
Mm.
So if I eat white bread, my blood sugar is going to rise a lot. If I eat rye bread or pumpernickel bread, my blood sugar will rise to a lesser degree. If I eat sugar, table sugar, my blood sugar will rise a lot. If I have fruit, even if it's sweet, my blood sugar doesn't rise as much as it does with table sugar. So to choose low glycemic index food, I'm just choosing the ones that are gentler for my blood sugar. So here's the way to make sense of it. There are only a few things where it really matters. Instead of wheat bread, rye or pumpernickel are better. Instead of big white baking potatoes, you're better off with a sweet potato or a yam. Instead of sugar itself, you're better off with fruit. And something like white pasta is actually okay. Spaghetti, which surprises many people, it's actually fine because it's so compacted, it doesn't digest particularly quickly. So that's about it. Instead of having something like a cold breakfast cereal, if you have porridge, oatmeal porridge or other kinds of porridge, I think that's fine. Parboiled rice is better than ordinary white rice. But having said that, rice in general, I think, is okay. When you look at cultures that have consumed rice, generally they do fine. It's when they start bringing in the cheese and the meat to eat next to their rice that they don't do so well anymore.
True. How would you exactly define the whole food plant-based diet?
People use these words in different ways, but the way I like to use that word is I use it synonymously with vegan, meaning I'm not eating any animal products at all. That's first of all. Now, when people say whole food, what they're often referring to is if I have brown rice, that brown color comes from a layer of fiber on the outside of the rice. If I polish that fiber off, it becomes white, but it's not the whole food anymore. So if I eat it with the fiber in place, brown rice instead of white rice, that's healthy. So the more we leave foods intact, the better off we're going to be. So that's why people use the word whole foods, plant-based diet.
So is a reversal of type 2 diabetes possible eating a whole food plant-based diet?
Sure. Yeah, absolutely. Back in, maybe 2004, we were finishing up a research study that we did for the National Institutes of Health here in Washington. And I had a man who had a hemoglobin A1C of 9.5, which in a person with diabetes, you want it to be below 7, so 9.5 is not good. And he went on a vegan diet, and he lost weight. He lost a fair amount of weight over about a year's time. He stopped his medications, and his hemoglobin A1C dropped to 5.3, which is really normal.
Yes.
And I have to say, when we first started seeing cases like this, I was a little afraid to report them because the whole prevailing wisdom at the time was that diabetes never goes away.
Yeah.
That got diabetes, you're never going to get rid of it, and don't you tell anybody they don't have diabetes anymore. But we've seen it so much. We've seen so many people where their diabetes goes away that we now think about it differently. Diabetes is not a one-way street, it's a two-way street. And for many people, they've gone very far down that street. Sometimes it's harder to go back. But the sooner a person adopts a low-fat vegan diet, in other words, get the animal products off the plate. And when I say low-fat, I mean keep the oily foods low too. When you do that, you have the best chance of reversing diabetes.
Okay, what would be the protocol that a type 2 diabetic should follow, and how soon can you start seeing the results?
Okay. Well, first of all, let me encourage people to work with their healthcare providers, and make sure that they work closely with their provider. And that's for a couple of reasons. One is that if you're taking medications now, your medication needs are very likely going to change, and you want your doctor or nurse practitioner or whoever you're working with to be aware that you're making some improvements in your diet. And so what I would then do is let them know you're going to do a vegan diet. Don't let them talk you out of it.
Could you tell us a little bit of about PCRM and efforts you're making to getting in legislation and other things in the US to move on to?
Yes, it's a great question. But before we go there, let me give one or two words of caution for people, because I want them to do the Kickstart. I want them to do this program, but I do have a couple cautions that are important. I already mentioned one: do work with your doctor. Some people might think, well, I can just throw all my medicines away and I don't need to do that anymore. That's a mistake. You work with your doctor or healthcare provider. Number two, you need vitamin B12. Vitamin B12 is not made by animals or plants. It's made by bacteria, and bacteria in an animal's gut will produce some B12. Some people imagine that B12 in the soil or other places might produce traces of B12. On a vegan diet, it's really important to take a B12 supplement. You can get that at any kind of drugstore or pharmacy or health food store. It's very, very common. Just get the smallest ones you can and take it every day. Because if you don't have vitamin B12, you can have nerve problems or blood problems, and taking the B12 is really easy. That's the only supplement you really need. The other supplement people should think about is if they're not getting any sun exposure because they're inside all the time. You might want to supplement vitamin D. In nature, vitamin D on your skin sunlight on your skin makes all the vitamin D that you need. But if you're not getting any sun exposure, you should consider a supplement of vitamin D of about 2,000 international units. So that's it. My cautions are: let your doctor know what you're doing. Take some B12, and if you're not getting any sun, take vitamin D. And other than that, you're fine. Okay,
just a supplementary question on this. What most of our clients are facing a small problem when their blood sugar levels come down on a plant-based diet. Unfortunately, some of their doctors do not reduce their medication proportionately. They say once you start taking medication, that's it, you have to keep on taking it. So what do these people do?
That's a serious mistake. If a doctor has provided medication for the patient, whether it's a metformin or another oral medication, or whether it's insulin, injectable medication, that medication is powerful. But a vegan diet is also very powerful. So when a patient changes their diet, if they're still taking insulin, the combination of the medicine and the diet can drive their blood sugar down so low, it can be dangerous. The doctor must reduce medication in that situation. And it's better to stay ahead of it. So if a patient starts a vegan diet, they can start getting better right away. Sometimes within a week or within 2 weeks, their blood sugar is so low, they can get symptoms of hypoglycemia. And it's not the diet doing that. It's the medicines they're taking are too strong for them now because they're on a good diet. And the symptoms are shaking or sweating or anxiety. These are symptoms of low blood sugar. And so the doctor doesn't have any choice in this. It's a complete mistake for a doctor to not reduce medication. You've got to reduce the medication. So if the patient's on 20 units of insulin, they go down to 18 or 16 or 14 or 12 or whatever it is. And then the hypoglycemia can happen again. And so you just keep bringing the patient down. So the doctor needs to be proactive with that and bring the patient down on the medications. And it's very common that patients don't need any medication at all. And of course, the patients are thrilled with it. But no, if any doctor has refused to adjust medications when the patient's blood sugar is dropping, that's a big mistake.
That was a big one. I mean, that's a big problem we face here. So sometimes they either have to change doctors or it becomes...
No, I'm sorry. I mean, that's No, there's no excuse for that whatsoever. Because even if a person isn't on a vegan diet, people will have their blood sugar drop for other reasons. They might be over-medicated, or they might take up exercising. If a person starts running every day, exercising muscles reduce your blood sugar too. So the doctor has to reduce medication. This is not optional. This is not a choice. The doctor has to reduce medication if the blood sugar is falling low enough that it can cause a problem for the patient.
And it's also okay to be completely off medication if all the indications are right.
Yeah, of course, and you should be off medication. And with regard to diabetes medications, there's really not any question about it. A doctor should and will stop it when the indications are right. Same with blood pressure. Blood pressure can fall, and at some point, there are people who are on 3 or 4 pills for their blood pressure. And if they start a vegan diet, especially as they lose weight, their blood pressure gets better and better and better. And if they don't also start ratcheting down their blood pressure medicines, they could get a little lightheaded.
Yeah.
So the doctor needs to stop those too. The one area where we sometimes get into an unknown area is with cholesterol-lowering drugs like atorvastatin, which is marketed as Lipitor. Because there you'll have the patient who has a really low cholesterol level, sometimes even before they change their diet, because they're heavily medicated. And when they go on a vegan diet, their cholesterol is still really low, maybe even lower, and the doctor, there's no symptom. So the doctor doesn't stop it. And I don't really have a strong recommendation. Some patients just elect to continue the statin if they want to. Others will elect to stop it.
Okay. I'm sorry, I think I've taken up a lot of your time, but could you briefly just talk about PCRM? I saw a small video where you had 100 doctors coming together and promoting a vegan diet. Could you just talk a little bit about it before I let you go?
Sure. The Physicians Committee is a nonprofit organization. We're based here in Washington, D.C. We have about 12,000 doctors who belong, and maybe 175,000 members overall and supporters overall. We have been pushing the American government and other governments to improve their nutrition guidance so that they help people really to take control of their health. And we've had a lot of successes. We also have a medical clinic here where we integrate nutrition with the medical practice so that instead of neglecting it, we put the nutrition part right front and center.
Okay. Thank you, Dr. Neal Barnard. Thank you for your time. People will get a lot of information, and some of their misconceptions will get cleared. Thank you so very much for your time.
It's my pleasure, and let me thank you for doing what you do to get the word out to so many people. It's very kind of you, and it's been a pleasure speaking with you today.
Same here. Have a nice day.
Thank you. You too.